Do I like come this way?
Mm-hmm.
Okay. Great. Hi.
Hi, I'm Lauren.
I'm Linda. Nice to meet you.
Nice to meet you too.
Okay. So how are you doing today?
I'm okay. Yeah, I'm trying to recover from a cold, so it's a little rough, but getting there.
Yeah, I think that's going around.
Yeah.
Alright, so before we officially get started,
Mm-hmm.
I want to ask you if you had a chance to fill out the consent form.
I did.
Okay. Do you have any questions about that?
No, not at all, actually. It was pretty self-explanatory, so
Okay.
thank you.
Well, I also want to let you know that I'm a graduate student.
Mm-hmm.
I do have a supervisor,
Mhm.
and from time to time I do go over my work with her.
Okay.
So we might discuss some of the things that you and I talk about today, but for the most part, what is said in here stays in here.
Okay.
I don't just discuss it
Of course.
casually. And I also want to let you know that if you talk about harming yourself or someone else, or if
Mhm.
there's a chance of child or elder abuse that I
Mhm.
hear of, I do have to break confidentiality
Okay.
and inform the proper authorities.
Okay.
But overall, everything is pretty much stays in here.
Okay.
So do you have any questions about confidentiality?
No, you explained it really well, actually, so thank you.
Okay, so I've been looking at your personal history,
Okay.
and I noticed that you marked down anxiety as your presenting problem
Yes.
for coming here today.
Mhm.
So can you tell me a little bit more about that?
Sure. It was actually more at its peak last week. My boyfriend of almost 6 years, his father, really last minute, found out that he needed to get triple bypass surgery. So
Okay.
it was pretty intense for, obviously everyone in his family's very close. But also, like, I want to make sure he feels okay. Like, his family's back in Michigan, and how do I comfort him, before obviously he was going to go visit and be there. But, in that brief interim. So it was stressful, and it's like a very serious procedure where
Yeah, of course.
you don't know what's going to happen. The research nerd that I am, I just started researching it like crazy, and saw a lot of good things. So
Okay.
that helped calm the anxiety a little bit, and but it wasn't about me. Like, it was about, I wanted to use that information to make him feel better, because
Okay.
God only knows like what was going through his mind, and that's scary when you're not in home for that.
So how are things now?
They're better. The surgery went amazingly, actually, and he came back he was able to go home 2 days earlier than anticipated. So it's going very well.
Right.
Yeah.
Okay. Yeah. So is that the only thing you've been experiencing anxiety with? This one incident, or?
That was, I think, the main thing in the past couple weeks. Obviously, I'm in school, that can be anxious, or anxiety provoking.
Okay.
I just have to find more ways of really coping with it, because it tends to eat up a lot, or eat at me, and I'm a very big perfectionist, so that can, find its way into a lot of different areas of my everyday life, and the more areas it infiltrates, the bigger it gets, and the more taxing and suppressing it is. So that's something that I'm always trying to be aware of, and it's frustrating because even if I'm aware of it, it's like, how do I can have that right in front of me and be reminded to do it. It's just following through with it. That's the hard part for me. So I think I have gotten better at it, especially within the past year. Like, I'm trying to force myself, and I've done it more and more, where I'm not like going to spend 8 hours working on a single thing to perfect it, even if it means getting, a good result, or whatever it is I perceive that will be positive feedback. It eats away at me, and it eats away at the life around me. So
Okay.
I miss out on everyday life.
Okay. So you mentioned you were in school.
Mhm.
So where do you go to school?
I go to the Chicago School of Professional Psychology.
Okay, and that is it says it's a graduate school.
Mm-hmm.
So I can imagine how
Mm-hmm.
time consuming that is.
Yeah.
And you mentioned that you have the tendency for perfectionism,
Mm-hmm.
but you've found ways over the years to sort of
Mm-hmm.
like fix that. I don't want to say fix that, but
Yeah.
you know, calm that down.
Yes.
Okay.
Yes. It's just more about exactly to what you said. It's just even more now about like further instilling those things. Like
Okay.
really not just remembering them but accepting. I think part of there is certain stress that obviously comes up and
Of course.
me wanting to perfect certain assignments or a lot of them. But it's not nearly what it was when I was in undergraduate school. But I think a lot of that too is the previous job that I was in was so high stress and so much of a feeder into my perfectionism tendencies that right here, maybe part of the reason it seems better now, like much better than when I worked in advertising, was although I loved,
Okay.
if that makes sense.
Yeah, it does. It sounds that while you did,
Excuse me.
while,
Sorry.
it's okay. While you did enjoy advertising,
Yeah.
you seem to have found something that you really are passionate for,
Yeah.
and that sort of alleviates some of that need for perfectionism,
Yeah.
like within this area, because it's something that you're so passionate about. It
Yeah.
might come more naturally.
Yeah. Yeah. I think that is part of it too, is that it comes more naturally. It's hard because there's definitely parallels. Like, I often miss the research part, and there's times where I definitely miss working at the agency, but it took away so much of who I am and sparked so many different tensions all over my life that, it's not healthy. Like, looking down the line, I understand, you would hear all the stories about people, they get to those high levels and then they completely retire, or, obviously if they can, but, or they completely switch, I believe, but just my personal experience, it took a lot to come to terms with the fact that it was okay to not follow that path, no matter how much I thought that was my path.
Yeah.
Yeah.
Okay. So thank you for sharing that.
Yeah.
I would like to come back to that anxiety that you're
Mhm.
feeling right now, but I want to talk a little bit more about you.
Yeah.
And your personal history.
Okay.
So I see that you do not live with your parents.
No.
Currently, okay.
Yes.
So how is your relationship with them?
It's good. I've always been close with my parents. Feel very blessed to have the parents that I do. They're very caring and loving. Not to say that we don't have our stuff.
Yeah.
But yeah, I'm especially thankful for both of them and what they've done for my brother and I. Not just in the sense of providing us with opportunities, but actually supporting us through what we. And my dad got a lot of that from his side, and he's from Egypt, and I think part of it was very cultural.
Okay.
Excuse me. And that was one of the biggest things that he and my mom really came to terms with, is they didn't ever want to force my brother and I to feel like we needed to pursue a career in the sciences or law, so
Yeah.
I'm very respectful of that and appreciative, because from what we were just talking about, maybe that would have been enough, to sway me from making this transition to psychology from advertising.
Yeah.
Mm-hmm.
So it sounds like you're very happy with your relationship with them. They've been supportive of you,
Mhm.
especially with your choices, like
Yeah.
going from advertising to psychology.
Yeah.
They've been there for you.
Yeah.
Okay. So,
Very thankful. Sorry.
oh no, it's fine. You're fine. So you mentioned you have a brother,
Yes.
and he's also not living with you.
No, he's living with my parents. And remember, he's the best brother in the whole world. I think there's a closeness that we have that I've just been very thankful to have, because there's been supportiveness
Mhm.
from both of us towards each other, regardless of age. So even though I look up to him, you know, he seems to do the same to me, which is amazing, yet also sometimes unnerving.
Mhm.
It's more so since he started having his battle with schizophrenia.
Okay.
Sorry, that's kind of just like a jump into that, but
It's fine.
it's really honest, like in the sense of the unnerving part. Like when I've been so used to looking up to him my whole life, and I still do, and then a disease really takes him over, and it puts me in a certain area of responsibility, not just in our family relationship, but just me and him, that I always observed or perceived the opposite. And it's been a hard transition, and he's gotten so much better. It's a miracle. I don't, from the combination of medicine finally finding what works for him, and also just from, I believe, like constant praying from our family for him getting better, because it's like 3 years ago he was in a nursing home, on the psychiatric ward for 2 years, going through his mind and how he perceives us, that is completely different from 10 years ago. College, how out of tune it was to not out of, like, that's the only thing, like that's a preventative measure, because it's obviously not. And it's one of the biggest things I've learned about mental illness, and since it's been affecting our family, is it can afflict anyone.
Mhm.
Whatever your level of intelligence, sorry, I don't know, it's tough, but also amazing to see how far he has come with where he has been.
Yeah.
I do miss our relationship, though. Like I think, he'll come in when I'm home at my parents' house, and he's living there because that's where he needs to be right now, because he's not ready enough to be on his own.
Okay.
But I'll be doing some work in my room, and I'll just hear him walk down the hall, and I'll say, "Love you, Lauren." And he's always been like that. He's always been very loving, outright in that sense. And it's just how our family tends to be too. Like I think sometimes I scared my boyfriend at first, because I would just say I love you much. It's funny because he comes from the complete opposite kind of family, where they just keep it on the down low a little bit more, but it's obviously there. It's just not spoken as much.
Yeah.
So it's really comforting to still hear him say those kinds of things,
Mhm.
So the only thing that's really affecting him right now is you can actually, like, if he does it at the dinner table, which has gotten a lot less,
Okay.
we'll say it to his face. We'll be like, "What are you talking about?" And then he'll stop. So it's a real blessing to see how far it's come. And he'll probably struggle with that his whole life, because it's a chronic illness. But
Mhm.
I think, I know, because of his intelligence, but more importantly because of just the beautiful person that he is, like, he'll find ways to cope with it.
Okay.
Yeah.
So, your brother has struggled with schizophrenia
Mm-hmm.
for a while now.
Yes.
Okay, but he has gotten better
Yes.
to the point where
No,
he can come home and live with his your parents.
Yes, and he's going out, and
Okay, that's good.
yeah.
So it sounds that like you both have a relationship where not like he's your older brother, your big brother. You look up to him. That's what
Yeah.
I see that you listed some circumstances that affected your development.
Mm-hmm.
Do you want to say a little bit more about that?
Yeah. I don't know where to begin, but
Wherever you want.
probably the main thing, or one of the main issues that you're thinking of is my diagnosis of bipolar disorder. So that came about when I was 17, and I had gone away to a boarding school of my doing. I wanted to try it out. My brother had gone, and he loved it, and it was like a nice pathway to the college that I wanted to go to, or where I thought I wanted to be.
Okay.
And everything was amazing the first couple months, and then stuff started changing probably in November. And it's funny because not funny, but they say at that school that the winter time, and this was can get kind of depressing.
Yeah.
And so stuff started hitting me like out of the blue, where I just got really down. And it wasn't just really being down necessarily, but it was also I was having to be extremely down, not just the regular level of depression that I would be having, but really difficult. So, and I went back to school. I mean, it didn't do so much. Like, it helped definitely with the real lows that I experienced, because I never had mania. I had more of the bipolar depression, or that's what I have. But it was just really difficult to deal with when I was alone, and my parents and my best friends are at home, and I'm coming into a place where I'm good at making friends, but these are friends that I just made, and there's a certain closeness that is not there that was at home. And everything that goes along with that, like level of comfortability with saying how you feel about stuff, and it's tough. So I think that only exacerbated my symptoms at times. And then I don't know, I think that illness is probably one of the reasons that I decided to get more into drugs at the time. And I mean, I had smoked pot prior to going to boarding school, but never really got into it. It was just like occasional, and never really drank. I mean, I would drink at parties and what the typical teenager does now, which is not good. But I was never really involved in something, and it was more just social. And I was always that person who never thought I would do anything serious, not to mention fall into anything seriously. And I remember one day we were at a hotel for what they had organized as a parents' weekend. And long story short, again, they had one of my friends, the rooms they had in the bathroom, there was cocaine on the counter. And I looked at it, and it's like you see all of that in movies and all this stuff, and you hear about it, and you have all of these predisposed dispositions to it about just this hard drug that you would never touch, at least me personally. And it was just there, and the mere proximity of it almost cut that all away. And that, coupled with what I was going through, it was a way to alleviate some of the pain at that time. And so I tried it, and I didn't really feel anything from it at first. or even that time. And I don't know, maybe what I didn't take enough, or I don't know what it was, but I didn't really get any of the effects.
Okay.
From then on, I had never done it until I decided to go back home for my senior year of high school. And then I don't remember the exact instant, but senior year of high school, was hanging out with some people, especially this one person who was 2 years above me. And we went to this party, and, in the car on the way there, he brought it out. And I went along with it. And I think that previous experience had broken that barrier for me in terms of me not seeing it as scary anymore. Plus, I think it made me feel that much more of the sociable person that I am in certain settings, and just really up and on top of the world. And it also helped me not eat, which was another thing that I was dealing with at the time, which I have been for a while, is my eating issues. It was the skinny drug, and that was only a positive side effect of it. So then stuff just started, no pun intended, snowballing, for the next 4.5 years.
So,
Yeah.
yeah. So, you went away to boarding school,
Yeah.
and you started noticing changes in your mood.
Yeah.
And overall, you were diagnosed with bipolar 2 disorder?
Yes.
Okay.
Yeah.
And then, the medication you were taking helped, but
Yeah.
I mean, you were away from school, you're not with your close friends, your family, so, I mean, I can understand why that was tough. And then you were at a party,
Yeah.
and someone had cocaine,
Mm-hmm.
and that is a drug that is known for, it's an upper,
Mm-hmm.
elevates your mood, it's like, oh, it's fine.
Yeah.
Is that something that drew you to want to take it, did you know anything about
I knew.
cocaine before you took it?
Yeah. I mean, that's a really good question, because it's what I did know. You hear in DARE and the kids at school who, really got involved with it, and then everything fell apart, but that's never going to happen to you.
Okay.
So I did see it as something that was not good for you, obviously, and that could lead to really bad things, but at the same time, that's where I don't think, just from the advertising perspective, you can't prey upon the danger of it to ward people away. And what's most resonating is showing the reality of that drug in regard to what you normally love to do in your life,
Mm-hmm.
and the things that it takes away.
Okay.
Not so much in a standpoint, sorry, now I'm getting into the advertising. So.
Yeah, that's fine.
But to your question, it's basically, I had mixed feelings about it, but I think one of the biggest factors that made me do it was I was still curious,
Okay.
My parents never really talked to me about it. If they did, it's bad, and that's something that I don't want to do with my children one day. If I have children, I want to be very open with them, because, that's how they need to see it as a reality. And that curiosity can be so intense that no matter how much bad you hear, sometimes even because you hear so much bad, it cancels out. and you're like, okay, well, I'm invincible, you know? So, yeah, I saw it as something bad, but then I also saw it as something that could be an escape.
Yeah, and from what I'm hearing, it was also something that heightened how you normally were before possibly the depression came in. You were social, and it only heightened that.
Yeah, exactly.
Yeah, so for a while, was it helping you with your feelings of sadness?
Oh, yeah.
Yeah. Okay.
Yeah, sorry, go ahead.
Oh no.
It was, I mean, when I was back at home, it was definitely helping me. But then I had started to go to school, and
so you're back at your other.
So I'm sorry. So I had graduated.
Oh.
I never graduated with my class. Like, that's when it really started escalating, and I got behind on a lot of my work. I mean, I graduated on time, but I chose not to walk with my class just because stuff really started going downhill.
Okay.
And it was tough, because you have pictures of your friends like all in their caps and gowns, and you'd rather just have the diploma.
Yeah.
Because the next thing you care about is just only getting high. I was just so amazed at myself, and at the same time, that only
fed into it.
Exactly, because I could see myself being capable of doing that and functioning and covering it up. But then soon enough, it does the opposite.
Okay. So are you still using?
No, it's been 6 years. Last September 19th.
Okay.
So it's each 19th actually of the month I try to celebrate in a little way, even if it means just like
remembering.
Yeah, or getting a cupcake. But so sad. But I mean, excuse me, in the sense that like it's important for me to really, and it's still tough. Like, it's funny because I went to several rehab programs, or trials at least, during that detox center and within a hospital that I finished. And I don't, after that, I never went to any meetings. And I always wonder, what that would have done beyond me just quitting like that and not doing support groups or that kind of stuff. I tried doing 1 or 2 of those, but I didn't get much out of it. Maybe that was because of the stage where I was, and just, normally when you're a recovering addict, it's hard being in a room where, I tend to focus better on my own and not in group settings, and maybe that's one of the reasons. But at the same time, I mean, I'm okay up until this point, and I find my faith and some other things in my life really help me get through what I've been through and stay sober. The other main thing that really just keeps me sober is I'm scared to die, because I almost died several times. I don't know why I'm still here sometimes. I mean, I do, but it took me a long time to really realize that, because, I had seizures while I was driving, and
from your use?
From my use, yes.
Okay.
And that one was on a binge weekend, and I had driven, and it hit me as I was going onto the ramp on I-55, and luckily I had my boyfriend at the time able to take the wheel and go to the side. And then, I had several other seizures where, God knows, if I had not been near a bed, somewhere where I didn't hit my head hard, I had not overdosed, and it had gotten so close, to where you are in the hospital, and to where they're pinnacles of, just a little bit more and you're done. So, I can't remember how we got into that, but.
So would you say, like, those things that happen, the seizures,
Yeah.
like, it was getting worse?
Yes.
Is that what made you go into rehab?
That was part of it, and then part of it was just my parents were like, you need to go.
Okay.
Like, they do so much. As I was 21 or 20 at the time. No, 21. So that, yeah. But it's that scared feeling of dying that keeps me from doing it. Because I have found out that so much of that has actually happened for a good reason. I wouldn't be where I am today if it wasn't for it. And that's like, 10 other sessions down the road, but it's something how I enjoy people and how I just want to spread goodness and love and, sound like I'm a, kindergarten storybook, but like, it's just when you really hit the crap deep down, you just want to do the opposite. And you just want to help others who have been in that same place. At least I do. Like, that's why I want to do this now.
Okay.
Help them be okay with who they are and realize that they're not alone. Because it is an epidemic that is so much more prevalent than what people put a name and face to. And that needs to be understood. And I think that's part of maybe why I also did have that time in advertising, like maybe I do look down the line trying to use my skills there as a way of raising more awareness for drug abuse and mental illness overall. So
I think that says a lot that
you.
you were able to overcome that, even if it meant like your parents you had hit a bottom and you're using that. Okay. So I know we kind of went off on a different pet. No, it's okay. But I would like to tell you that I would want to talk more about your anxiety next time.
Yeah.
And if you want to continue talking about this, that's
Sure.
not a problem.
Maybe the anxiety, the perfectionism tendencies.
Okay.
Yeah.
So this is not something that you want to keep talking about?
I feel I'm always open to talking about it. I think right now my main thing is the perfectionism, but obviously, I'm always learning about the stuff that I went through and what that brings to me today.
Okay.
Yeah.
So, sorry.
No.
Okay, so I'm going to ask you now a few questions that might seem a little bit strange.
Okay.
And just do your best in answering them.
Okay.
And I'm doing this as part of the intake.
Okay.
This isn't going to be a normal thing.
Okay.
So, do you know what the year is?
2012.
Okay. And do you know the season?
Fall.
Okay. And today's
Almost winter.
Okay.
Sorry.
That's right. Today's date?
November 9th.
Okay. And the day?
Friday.
Right. Pretty good. So where are we now? And do you know what floor we're on?
4th.
Alright. So I'm going to name 3 unrelated objects.
Mm-hmm.
I'm going to list them.
Okay.
And then I'm going to have you list a picture.
Chair, door, picture.
Okay. Okay, so the next one might seem a little bit hard.
Okay.
I know it would be hard for me. So I would like you to count backward from 100 by 7.
Okay. Bear with me.
Okay. Take your time.
100.
Okay.
93.
Okay.
86.
Yep.
79.
Yes.
Oh, 72.
Yeah.
65.
Yes. Very good. Okay. So earlier I told you that list of those 3 things. Can you tell me those 3 things again?
Yeah. Chair, door, picture.
Yes.
Well, sorry.
It's fine. Okay, so I had a pen. I don't know where it
Hint.
Oh, here it is. Okay. So I'm going to show you two objects.
Okay.
And I just want you to name them.
Okay.
So I have this.
Pen.
Okay. And this.
Ring. Pretty ring.
Thank you.
Yeah.
Okay, so I would like you to repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Thank you. Okay, I'm going to give you a sheet of paper, and I would like you to take it with your right hand.
Okay.
Thank you. And fold it in half. And then place it on the floor. Okay, thank you. Okay, and I have a written instruction, and I would like you to do it.
Okay.
Thank you.
Mhm.
Okay. And just make up a sentence about everything, but just make sure it includes a noun and a verb, and it could be anything.
Okay. I can't wait to get a cupcake.
That would be nice.
Yes.
Okay, so I have this picture,
Okay.
and I would like you to copy it for me.
Okay. Let's see.
Okay, very good.
Hmm?
Thank you.
Sure.
So what we just did was a mini mental status exam,
Okay.
and it's just part of the intake.
Okay.
We won't be doing that again,
Okay.
but you did very well,
Thank you.
so
Okay.
very well.
Oh, thanks.
Okay, so now I would just like to ask you if you have any questions for me, or if you would like to,
Yeah.
if is there anything that you want to, I know I asked you this a little bit before, but is there anything you want to ask before we end today?
I guess is there anything that you saw from what I've been talking about that you think could need more work on?
Well, I think a lot of the anxiety might be coming from, school
Yeah.
and other stressors, just life happening.
Yeah.
And I mean, you've already have gone through so much, and I think you're a strong person, and I think you know ways to cope, but you just need, maybe a little bit of time to talk about that, a little bit more, just, I'm not sure about the right word, but just help in the right ways to be coping with these anxiety-provoking problems.
No, I see exactly what you're saying. I think you're right.
So if you want to talk more about your past, or if you just want to focus on the present, we can do that. We can, if you already have ways that you cope, but you're just not doing them, maybe we can help you
Yeah,
do
that'll help.
them, or find new ways.
Okay.
So whichever way you want to do this,
Okay.
whichever way you want to take this.
Thank you.
Okay.
Thank you. You're a wonderful therapist.
Thank you.
Yeah.
Thank
very
you for
easing me throughout the whole conversation. So it's very nice and calming.
Well, thank you.
Yeah.
And thank you for sharing with me today all
Yeah.
those things. I know it's not always easy to talk to a stranger about that.
Thank you.
Okay, so we're done here today, and I
Okay.
will see you next week.
Okay, sounds good.
Thank you. It was
Thanks,
nice to meet you.
Linda. Nice to meet you too.
All right.